And welcome to our virtual winter health fair regarding COVID-19. Over the next 30 minutes, we will each be presenting a topic related to COVID-19. I'm Brittany and I will be presenting long haul COVID. Long haul COVID is a wide range of new, returning, or ongoing health problems people can experience 4 or more weeks after first being infected with the virus that causes COVID-19. It can also be referred to as long COVID, chronic COVID syndrome, post-acute COVID, long post-COVID syndrome, and persistent post-COVID syndrome. They all mean the same thing. There are 3 different types. The first type is for people who don't recover from their acute phase. They're just sick, ongoing, nonstop. The second type deals with chronic hospitalization. It's a post-ICU care syndrome type thing. And the third type is symptoms appear after they've already recovered from their initial sickness. So not a lot is known about long haul COVID right now because it is new, but possible causes include unmasking of underlying comorbidities, damage from the acute infection, the virus continuing to replicate within the body, the immune system continuously being activated, and then the most common is unknown or idiopathic. They don't know what causes it. So risk factors include gender. Being female has shown an increased risk of getting long COVID. Experiencing 5 or more symptoms in the first weeks of infection might indicate long haul COVID. Early difficulty breathing, prior psychiatric disorders, and specific biomarkers like D-dimer and lymphocyte count. Again, these just increase the risk. They haven't really found any pattern yet. There's a wide range of symptoms and then long haul COVID. So symptoms of long haul COVID affect multiple body systems. The neurological symptoms are brain fog, eye issues, persistent loss of taste and smell. Cardiovascular symptoms include blood clots, chest pain, high blood pressure, palpitations. Respiratory symptoms include exhaustion after little exertion, shortness of breath, fatigue. Mental health symptoms include anxiety, PTSD, insomnia. And then there are kidney dysfunction, new onset diabetes or worsening control of pre-existing diabetes, and skin rashes. Long haul COVID is diagnosed based on symptoms and the fact that you have had COVID-19. There are no diagnostic tests or biomarkers as of right now. So potential treatments are based on symptoms. So counseling and support for mental health symptoms, diabetes care, medications, if you need them for high blood pressure or whatever, physical therapy, and pulmonary rehab. And people have reported symptom relief after getting the vaccine. Again, this is all still being researched by scientists and doctors and everybody involved. Not a lot is known about it right now, but they are working on making this and getting to understand it. So we have a few stories to share, one of which is this 36-year-old individual. They started off with a fever and fatigue, which progressed to trouble breathing and pain while breathing and low oxygen levels. By the time they got an X-ray, they found out that it had progressed to advanced COVID-induced pneumonia. This individual was hospitalized and put into a coma on a ventilator for 31 days, during which they suffered a stroke, lost the ability to walk, left-sided weakness, and blood clots. 6 months later, they're still dealing with chronic lung condition that may be for the rest of their life. They're undergoing pulmonary rehab. They have brain fog and fatigue and new onset type 2 diabetes, where they were not pre-diabetic before COVID. And of course, eyesight change. This individual is 25. They had a mild case of COVID-19. They were never hospitalized, but weeks later, they developed vision issues, ringing in the ears, and everything smelled like cigarettes or Lysol. They had tingling in the legs and hand trembles and brain fog. This individual was trying to concentrate on work, and she kept forgetting what they were talking about and what she was going to say. And she was later referred to a long haul program months after a COVID diagnosis. And then initially, we didn't think COVID affected children. However, we are seeing long haul COVID in children. And these are 5 children, ages 4 to 15, battling long haul symptoms for 11 months. Heart pain, breathing issues, rashes, bleeding noses, mouth ulcers, peeling hands and feet, gastric issues, testicular pain. These 5 children are undergoing a lot of symptoms related to long haul COVID. So this is what a healthy lung versus a COVID-19 lung look like. And up in the corner here, you have a healthy lung, a smoker's lung, and then a COVID-19 lung. So we're seeing a lot of damage in COVID-19 lungs. And you can see that on the x-rays here as well. So what can be done about long haul COVID? There are multiple hospital systems that offer programs to those who are suffering from long haul COVID. Hackensack Meridian Health, RWJ, St. Peter's University Hospital. Again, it's symptom management while researchers work on what can be done to cure these people. There's a little quiz that you can take at this link if you're interested. And that is all. Thank you so much for coming